I am Dr. Sreekanta Swamy, lead consultant and head of the Department of Neurology at Aster RV Hospital, JP Nagar, Bangalore. I am here to give some information regarding migraine headache. I think it is everybody's problem. Most of the population in the world, they have experienced migraine headache at one point or the other. It's such a common problem. It is second most disabling condition among the neurological conditions. And this is commonly, it occurs in from any age, for example, from pediatric age group to late age also, but most commonly it occurs somewhere between 15 to 30, 35 years. And the importance of knowing about migraine is one thing, that it puts a lot of burden, both economically as well as stress on the family. Because if a company head has got a migraine headache, the whole day is spoiled for not only for him, for his employees, because he will be irritable, he will not be in a mood to receive any inputs, and he will shout on his employees. So it creates a very chaotic atmosphere in the company where he works. So similarly, in the family, if a family head has got a migraine, the whole family will be affected indirectly. And this is a common problem wherein females are affected more commonly. Like for every one male affected, there are 3 females affected. And many people think it's a normal headache. Yes, it is one of the type of headache. It is not a normal headache. There is nothing like normal headache. When migraine comes, the people who are suffering, they know what is the intensity and what is the disability they experience. So some of them, they just avoid going out, meeting their friends and relatives, because if they get a headache there, it will be a nuisance. So that makes them depressed. So these are all social problems of the migraine. Then just a few points about why it comes. In fact, migraine is said to be hereditary disease, meaning you are born with it. Your brain is sensitive, hypersensitive to many things. Those are called triggers. In a given person, the trigger may be 1, in another person it can be 2 or 3. So you are born with that migraine tendency, but at certain ages it starts to give you problem. It normally gives a headache on one side, which is like a pounding headache, which is like a heart beating headache, which lasts for anywhere from 1 to 3 hours to 4 hours, sometimes up to 1 day. And it is usually moderate to severe. That is a very important point. Whereas the most common headache type is called a tension type headache, which is not moderate to severe, but it is mild. A person who has got a tension type headache will have nagging headache, but still he can do his day-to-day activities. Whereas a person who suffers from migraine, he sometimes is forced to stop his work, stop doing his work and relax. So that is a kind of severity in migraine headache. And many people experience some visual symptoms like blurring of vision, or one day before they get migraine, they experience some different feeling like depression, not interested in going out, craving for certain food, or mood changes, etc. After that, they develop a headache. And once the headache comes, they don't like to see the bright light, they don't want to hear loud noises, and they don't feel like going out, they don't feel like talking to their people. So these are common symptoms. And after the headache goes off, they feel exhausted and they want to relax for a few hours. This is a whole group of symptoms of migraine headache. Many people don't even consult the doctors for this type of headache. Unfortunately, only about 40 to 45 out of 100 people with migraine will be seen by doctors. Remaining 40-45 are not even diagnosed as a migraine. They go to the medical shop, take some medication and be done with it. These medications are going to give only relief for few hours, but again it will come. So it is important for us to diagnose migraine properly, basically because if you don't control your migraine, which is coming frequently, then you may land up with what is called chronic migraine, which is a tough headache to control. It may require hospitalization, it may require a lot of medication, so the economical burden indirectly increases. So it is important to control the migraine when it is at the early part of the illness. And as I mentioned, all the investigations which you do for migraine, nothing may show any abnormality. But we still occasionally do sometimes, because there are some problems which can result or mimic like a migraine headache. So we do ask them to do at least one time the brain scan. And there are multiple treatments that are available. You must also remember, migraine so far, as of now, there is no permanent cure in the world. Whatever we give, it is to control the severity and frequency of the headache and symptoms. So we have in our hand two kinds of medication. Rescue medicine, which gives you relief when you have headache. We have preventive medicine, which does not give you relief when you have headache, but prevents you getting next day headache, day after tomorrow headache. So rescue and preventive medicines are very important. And those who get headache 3 to 5 times in a month, which are severe, disabling, those are the people who require preventive medicines. Whereas if somebody gets one headache in a month, which is mild but relieved by simple analgesic, it doesn't require a preventive medicine. And there are different groups of medication that are available, starting from simple analgesics or painkillers, anti-epileptic drugs, anti-hypertensive drugs, and antidepressant medication. There are so many groups of medication. Depending on individual, we choose the medication. Most important thing, you have to manage your lifestyle properly, because that plays 50% of the role of treatment, like proper sleep, especially timing of sleep. You sleep more, you sleep less, both can give you headache. And you eat in time. Basically, if you skip your breakfast, many people experience severe headache. And if you sleep late, you can experience severe headache. And stress is another important factor nowadays because of the IT boom. IT people have a lot of work stress and they sleep erratically. And that is one of the very common reason why they get frequent headaches, and which is severe, which is not controllable by the simple available medication. Of late, for the last 3 to 4 months in India, we have got one more weapon in our hand, that is called monoclonal antibodies. It is called Erenumab, which is available in India right now, but the cost factor limits its popular use. It costs almost about 20 to 22,000 per injection, and it has to be given once a month. But advantage of this injection is that if you take one injection, if it starts to help you, you are not going to take, you don't need any medication in between. Next you are going to take after 1 month only. And like that, we have study up to 5 years now, patients are on this, which is quite safe compared to available medication. Side effect profile is extremely good. So what I want to tell public is that you have many things in your hand to help yourself. Only thing is, you need to see the right person for right advice. Many people don't, throughout their lifetime, they will be managing their headache by themselves over the counter medicine. And many people also go to general practitioner who are not recently updated about the availability of recent medication. So you need to see a right person to get a right advice. And if you by any chance land up with a chronic migraine, which is very difficult to manage even by the specialist, then you will land up with applying, say, a few days of leave to your office, spend quite a few thousands of rupees for your treatment and investigation, and it will hamper your income. So you should not allow that to go to that state. So my message to public is that if you have a headache, you don't know whether it is migraine or not, but you can, most of the time you can make out that it is probably migraine when it is pulsating, pounding, severe, vomiting, nausea, dislike to the light, sound, etc. You consult a right person, consult a good physician, consult a neurologist. Many people go to simple compounder and then ask for a tablet. They will give medication, no doubt, but it will be only temporary. So it will relieve on that day, but next day again you will get it. So instead of wasting time, you should see the right person and get the right advice to lead a comfortable life. Many people want a comfortable life and a headache-free life, which can be to a greater extent given if a proper medication is used and also proper lifestyle is maintained. It is important, also very important, to maintain your lifestyle properly, eating time, stress control, etc., which can help you along with the medication.